Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons from real cases we see every day. Behind every symptom is a real story, and today's topic comes from one we see more often than many people expect. That is why we approach it from four perspectives: what the doctor sees, what the nurse observes, what the pharmacist safeguards, and what the dietitian supports. It often begins as something simple: a stressful day, poor sleep, or fatigue. So something is taken for relief and it settles and life continues. But the pattern does not disappear. It returns again after days, weeks, sometimes in cycles that begin to feel predictable. It begins to happen more often, lasts longer, and no longer responds easily. It no longer feels like an isolated episode, it becomes a pattern. And that is where clinical thinking begins. Because a headache is not just pain, it is a signal. We ask, when did it start? Is it different? Is it worsening? Are there other symptoms? We look for the underlying cause that your body is trying to communicate. The nurse observes the vital signs. Beyond the pain, they monitor your heart rate, your respiratory rhythm, and your overall physical stability. One of the most important systems we evaluate is blood pressure, because it affects the brain, heart, kidneys, and blood vessels all at once. When pressure rises too high, the system is strained. And what started as a headache becomes a warning signal of a hypertensive crisis. The pharmacist safeguards your treatment. They look at the medications you've been taking for relief. Are they effective? Are they masking a deeper issue? They ensure that the relief you seek doesn't interfere with the long-term management of your cardiovascular health. Safety is the priority, and the dietitian supports the foundation. They examine the fuel you give your body: high sodium, lack of hydration. These are silent contributors to the strain. By adjusting what you eat, we can often reduce the pressure on your system, preventing the crisis before it ever begins. It's about sustainable health. At very high levels, high blood pressure is no longer routine. It becomes a hypertensive crisis, where the risk to your organs becomes very real. In these moments, immediate action is required. This is why we tell you, do not wait for the pain to become unbearable. Listen to the early signals. A headache may feel small, but sometimes it is the first sign of a system under stress. Do not assume, assess. Your health is your most valuable asset. If you experience persistent headaches, dizziness, or elevated blood pressure, seek proper evaluation early, or call/WhatsApp +233 208 720 347. And remember to watch the other perspectives from the nurse, pharmacist, and dietitian, because each completes the picture of your total well-being.